One thing that's interesting as well is that individuals with cognitive decline or dementia oftentimes experience poor circadian regulation. So individuals with dementia often experience things like the sundowning effect, where they tend to have different circadian cycles than individuals without dementia. So they'll have trouble being asleep throughout the course of the night, which is oftentimes an issue for clinicians and healthcare workers that are working in those kinds of settings. But what we also see as well is that individuals that are more at risk for dementia and cognitive decline will oftentimes have poorer circadian rhythms than their healthy cognitive counterparts. So with this being said, while there are ways that we can identify circadian dysregulation using things like actigraphy, which is a Fitbit or something very, very similar, which can detect the amount of movement that's occurring throughout the course of the day, we don't actually know whether or the extent that we can improve actigraphy settings to be able to detect more issues with cognition in particular. So as a first step towards trying to understand this, we're trying to use machine learning in particular to be able to see if we can identify cognitive function with a little bit more accuracy than the current methods. And so one thing that we've been working on is trying to develop an algorithm using a deep neural network that's going to be able to identify cognitive function with a little bit more accuracy than is currently available. And so to do that, we've been using data from the UK Biobank, which is about 500,000 people in total, but a subsample of about 50,000 people who have valid actigraphy data, and then also cognitive function data, in order to be able to look at whether we can indeed predict cognitive function from actigraphy.